Here in the posterior triangle. So this is the sternocleidomastoid. Here we have got the trapezius muscle posteriorly. This is the clavicle. So this is the entire posterior triangle divided into two compartments by this inferior belly of omohyoid. So below the inferior belly of omohyoid we have got this structure which is known as the subclavian or the supraclavicular triangle, and superiorly here we have got the occipital triangle. Now in the occipital triangle, the thing that is most important is this group of nerves. So this is one group of nerve, and if we note that they are coming from the posterior aspect of the sternocleidomastoid and they are going towards the clavicle. Here is one more nerve that is again coming from almost the same place, that is posterior aspect of the sternocleidomastoid, but this time this nerve is going posteriorly towards the trapezius muscle. So this particular nerve is known as the spinal root of the accessory, whereas this particular nerve is known as the supraclavicular nerve. Now if we go here, now this body is a bit distorted, so it is appearing a bit different, but nonetheless these are the formative roots of my upper trunk, which is here. Then we have our middle trunk, and then below it, deep to it, we have got the lower trunk. Okay, so these are the three trunks of the brachial plexus that we come across in the posterior triangle. Now it may appear as if they are present in the occipital region, but they are not. It is solely because how the body has been kept and because of the distortion that has happened. These structures are actually a more common content, or they are actually a content of the supraclavicular or the subclavian triangle. Definitely here if we go deep, we will be finding two more structures, that is the subclavian vein lying superficially and the subclavian artery present in the deeper plane. Okay, so that's about the entire aspect of the posterior triangle.